Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk this morning about making space for erupting permanent teeth. Frequently in the mixed dentition, the permanent teeth are so much larger than the deciduous anterior teeth, and we'll just talk about the anterior part of the mouth today, and I'm going to come back later and talk about the working out the space allocation for the permanent bicuspids and right in front of the permanent 6-year molars, as they're already in there. So let's get started. People will bring their children in. A lot of times we'll have to you look in there and you've got your permanent permanent 4 teeth. You can see a little bit of the left lateral right there coming in between those teeth, and these are already over in this direction, and so we're going to have to make room for these teeth to erupt into the mouth. And if I started this pulpotomy business over 50 years ago in the late 60s, and we did this for some time, and then I published a paper on this and showed how you do this in a drawing and everything, and we've been doing this for years, and I must have done over 1,000 teeth like this, because each person, if you do this on them, you do 8 different teeth. You do these cuspids first and get them, the anterior, the upper, lower, and then you go back for your second deciduous molar and you reduce it, and you eliminate that, get the cuspid in and get it going, and then your second bicuspid will come in this space right here. Just follow me. If you stick with me now, we'll go through this thing and show you how this is done. And we're letting nature take over and do the orthodontics. We don't touch them. Rarely do we have to in this process, as far as putting orthodontic appliances and everything in there. So let's get on and show the teeth as they erupt into the mouth. So on the right side, you see you're going to have to get these 3 lower anterior teeth, permanent ones, moved over to the right side of the mouth. So the first thing to do, though, is we've got to get this open in this area so that lateral can come through this gap right here. And you think we're going to let nature move the teeth, and we're just going to provide a space for the nature to do this. And it works. And I've been lecturing on this for years, and there's not too many people go into it, but you can, well, this particular young lady here, we just did this, and she never did have any orthodontic, regular orthodontics done. And she grew up and moved off to another town and married and had a little girl, and she brought her back to me to do the same thing, so she wouldn't have to have braces. Now, you can't tell somebody they don't have to have the braces to finish them up. Now, if a person doesn't have any deleterious habits like thumb sucking, swallowing, mouth breathing, and allergies, and a lot of that, they'll push their teeth in the correct position in most of the cases. Now, it could be that the person they've got such large teeth. There may be a mixed marriage. Say if somebody marries a large-faced person, and they've got a thin-faced person, and the child may get the big tooth from one side of the family and have the small bone structure on the other side, and there's no way that you can go in there and do this type of case without extracting or reducing the teeth, unless you just shove them right to the back and then you pull out the back teeth. So it's something that is ridiculous. There are people thinking you never need to take out teeth. We do take teeth out from time to time, but it's pretty rare. All right, let's get on with this and show you what we're going to do here. On the right side of the the left side of the mouth, this cuspid tooth here, this is a deciduous tooth. Now, we're going to have to take about a half of it off and come down into the gum tissue. If you look real carefully, you'll see that lateral coming in behind. When we look on top of it, you will see it. Now, a lot of people are coming in and they just extract this tooth and they extract this one over here. And when you do that, this tooth has a root down in here. And when you take it out, you lose all that holding that space. And this bicuspid will drift over into that root space, and you're going to lose arch length when you extract the tooth which is crowded. But you can come in here and take the top off, and as this lateral comes up in there, it's thinner on the root, it'll slide into place by the tongue pushing it in there. And let nature come in and do the movement of the teeth. If somebody is doing swallowing and all these things correct, the tongue will move the teeth forward and the lips will hold it back there. And this is just, it's a dead cinch. This is how it happens. So let me get on through this. And the upper teeth are in the same fix. You're going to get a permanent lateral in here, and it won't fit in there. And there's another one over here, and it won't fit here. So we're going to have to take this cuspid down and this one over here and get the permanent laterals in there, and the tongue will push them out and line them up like that. And I didn't even put anything in this mouth other than this reducing these deciduous teeth. And if you have to take off 2/3 of it, I mean, you can cut the whole crown off in here. And we just infiltrate around to deaden the area. And then we go in, and I'll show you we were using a diamond burr, and this was back when I took this case. Back, we didn't wear gloves back then, and you can see this was one of the ladies holding the lip down for me to take this picture right here. Now let's get on. All right, here is the lateral tooth down in here, and we want this lateral to come out here. So you got to move or allow these teeth to go over this way. I didn't touch them. Now we just make space over here, which equals the amount you take off over here, and you balance it up, and these teeth will just move over on their own. And you wouldn't think this would happen, but just watch it happen now. And this lateral here, we'll have to cut down, and we do not use a rubber dam. There's no need for it, and we can do this, and you're going to be down in the area of the gum. You'd be grinding the rubber dam up anyway, and we use a brand new burr if you can sterilize it and everything, and we're going to cut the tooth off like that. And now let's go on and get this. Let me get over here and show you. And this again, we just back in the same side. We're going to have to balance it off now with a mount over here, and you take your Panorex and you can mark down, and you can see how much space you're going to need. Now I use Panorex. I don't have one on this particular case right here. And this is the one now we're going to have to cut down here. So you don't want to touch this tooth at all, this permanent tooth, with this burr as you cut this tooth. So you get out and you get out in front of it and cut it down deep underneath here. Now we've infiltrated on deciduous teeth like this. We don't have to block the whole jaw. Just infiltrate real good. Come in, put some topical, then put a little anesthetic in here, and get out in this area, that called the lingual, and deaden it, and you can go right in and take that nerve out, and the child won't feel any discomfort, pain with that, other than just the shaking of the reducing the tooth down. Now, here is the burr that we were using back then. Was a long tapered diamond right here. I later changed over and used a long carbide burr instead of the diamond burr. And we use a brand new burr every time, and we can put it in some type of sterilization and put it in. We want that good and clean, and that's what we cut the tooth with. Now take this burr and go down, and you go right through the nerve, and you get down pretty far, and you watch on the backside. Now use the vacuum and suck it up. I took a little tissue off here. You don't even have to do that. And suck this away. Don't blow any air on this. Just use vacuum, and it'll suck it out. And now we get down there pretty far, and we can take this tooth, and you see we're in the pulp, and the lateral from behind is up in the enamel structure. It can't go through it, but it'll eat the pulp out of the tooth in this area. And so we take something and crack this off. And now I can see that tooth better, and I'll go around it with a burr. And you don't just do this with a disc. Never take a disc after. You just can't do this with a disc. Cutting it off, you just hit the permanent tooth like that. We'll pop that off, and now we've got it cut down on this side and got it pretty weak. We just put a little spoon or something there heavy and push a little pressure on it and pop that part of the tooth off. Now I can see the lateral tooth down inside here coming up. So we get around it, and we kind of work around that lateral tooth so this tooth can start moving. As it moves over a little bit, the tongue will push on it, then these teeth will start moving in the other direction. And if you don't believe it'll work, just try this. This will work. And now we just aspirate, and we get in there. If you put a rubber dam on this, you'll be grinding the blooming thing up when you get in there. So we never used them, and I know 1,000 teeth like this, and I have, honest to God, never had one that I did that blew up. I had a patient, a dentist sent one in one time to do, and he didn't want to do it, and I tried to talk him into doing it, and he referred the patient to an oral surgeon who was an MD and an oral surgeon to do the pulpotomy, but he didn't know how to do the pulpotomy, and so that one blew up, but it still did the job. It was on a lower second bicuspid coming through, and it was on a deciduous molar. But that's the only one that I know of that has ever blown up, and I've been doing this for 50 years and lectured on it. And I remember one time in Boston, I had the heads of 3 deciduous sections of the dental school. We're teaching pediatric dentistry there, and they wanted to put something else in, but we put just packed zinc oxide eugenol. And I learned this from an old pediatric dentist from Shreveport back in the 60s. It was, I think, about 64 or 5 or something in there, and he was doing this, and I learned that from him, and I don't remember his name, but we've done thousands of these teeth. But it'd be 8 of them on a single person, you see. Now, you don't have to go through a lot of rigmarole doing it. You're going to be down here grinding on it, so you can't put a rubber dam on there, and you don't really need it. I've never had one of them blow up yet. So we go and take the nerve down and out of this tooth, and we're going to trim this around here, and we'll pack zinc oxide and eugenol down in there. I mean, with an amalgam plugger. You mix it up and pat it out on something to get as much eugenol out of it as you can, and you make it as hard as a brick. I mean, we roll this. This is eugenol on a. You just put your little pile of zinc oxide out here, and I like to use pure zinc oxide, and just drop a few drops of eugenol in here and mix this up and get it real hard, and then flatten it out, and you can take it and roll it up into about like a pencil lead out here, and you take a spoon about like this, and you can cut it off, and stick it on the end of the spoon and put it down into the canal where you've gone in and opened that up, and let it bleed. Don't worry about the blood. Now you take it like this, and this stuff you can pack it with an amalgam packer. Now the tooth is bleeding, and that's the way you want it. Don't worry about the blood. You pack that in there, pack it down, then put some more on it, and push it and smooth it off, then trying to trim this tooth up so they don't cut their lip on it. And this tooth has room, this lateral tooth. Now this is the central, and this is a lateral down in here. And it'll move over a little bit, and it slides by this tooth. Then these teeth will start moving toward the center. The roots are already over there, see, and they'll move back to the center. So we'll push that eugenol down into that hole, and we'll smooth it off, and then pack some more of this. And the zinc oxide, and this stuff will get hard, and it'll stay on there for a year or two, or however long it does. And if it runs out the end, it doesn't bother anything. I've never had one of them where this gave any trouble. But we do not do this on infected deciduous teeth. These are healthy deciduous teeth that we do this on. And I have tried it on a infected tooth, but we've seen other people try to do pulpotomies on infected teeth and deciduous ones, and they have a hard time making them work. Now, you watch this. I'm going to show you the picture of it. This is going to move over, and this tooth will come up in here, and the tongue will hit it here, the lip will hit it here, and nature straightens the teeth out. And they couldn't be in a better place. Now you've got to go to the other side of the mouth, take this tooth down, and the laterals in here, you don't have to worry about it. You can just cut this off down here, take it out, and pack that in with zinc oxide and eugenol. So there we're going in with that burr. It goes down in there far enough, and we'll trim it around the sides. Then you'll pack the zinc oxide and eugenol. Now this is an amalgam plugger, and we plug that stuff in. I mean, it is in there when you get through. I have to come in and kind of smooth a little bit more off of that and smooth the tooth up. You don't want something sticking up there, cut their lip on. You smooth it up. And I've never had trouble with a tooth if you take the nerve out. Now, a lot of people doing this, they say they get close to it, but I didn't hurt the nerve. Well, that will be the one that'll give you a fit. I mean, it's going to be sensitive and hurt. Take the nerve out. Then if you have to come back and do something to this tooth, you can go and do it. It won't have any feeling in it, but the tooth will go out and the resorptive cells will eat the root and the dental structure of the out from the crown. And I'll show you the crown on this second deal back here where we took a molar out, you know, and it is just enamel here without any anything in it. It's just an empty shell of a tooth. And so let's get on this. This takes a little time to say. We get it, smooth it out, and now here this was, I don't have a date on that, but anyway, this is 77. Actually, this is after we've been doing this for a good long while. And this tooth right here, this lateral now has come up and it's moved over in this gap, and these teeth are sliding over in this direction right there. Now we go up and we've got to do the upper too. So you watch it. You're going to come back, you're going to take them out, you're going to go down and do the pulpotomy on them. Now this is the lower. You see that lateral is moved up into this place where we ground this tooth out, and it's pushing these teeth over, and this one is over in here where it was away from the tooth to start with. You can go back on these if you want to look. You see, wait a minute, we were going the wrong direction here. And you see where the tooth was. And that tooth will move into this space right there. All right, we go up and we do the upper, and we've done the upper and the lower. And these teeth have already, look at that lateral was way down in there. The tongue has moved it up here. The lips catch it over here. And you haven't touched it with any kind of bracket. I don't give a hoot what you use. You don't need to do it. If the person is not sucking their thumb, pushing their tongue out, breathing through the mouth, and allergies and all this, you get somebody that's functioning good, and you can do this, and you can bring the teeth in without putting anything on there. And so this is better orthodontics than going in there and putting something in. Now you watch, you see where this midline is right here? It's going to shift over, and I think I got a picture in here showing where that had moved to. So here's the uppers, the laterals are down in here, this one is over here. The lip will catch this, it'll slide back into this place. This tooth will tilt around that way, this one over here, and this thing will line up without you putting anything in there. Now you can have all the diagnostic things you want to get, but there's nothing that is as accurate as the pressure from the tongue pushing the teeth and the lip catching it over here, and it puts the teeth in that position, and that's the place where that person's teeth ought to be. I don't give what kind of cephalometric mess you're going through with to figure out where you put them. Tweed was putting them at 40 and 90 degrees in here, and that was not right either. This was years ago. All right, let's watch this and go. We're going here for here again. I'm showing you the lower teeth, and I think the next picture we show you what these teeth have done on their own without doing anything. And this is where those teeth need to be. And now the tongue will keep pushing on this a little, and most of them will move right up in there. I could go in and trim out a little more space over here, but I've got space here, and if these whole teeth move over there, this will slide into that position. Now this is 77, and this is 78, and here this teeth coming in, and this tooth is right almost corrected right there. And now there's the upper, and we need to make a little more space up there, I think. So we may have come in and trimmed this a little bit back here. Those teeth have no filling in them. You can go in there and trim that. I've never had one that did a pulpotomy on that gave you any trouble. You can trim them and use them like that. And now the next go around, you got your cuspid. You got a big cuspid starting to come in down here, and it needs more space. So when either the cuspid starts in or the first bicuspid starts, either one of them, then you take the other tooth out, and you can take this piece off right here, and it won't bother anything, or there's the root of this tooth is there until this tooth erupts up through there, so you don't get your permanent bicuspid leaning in here. If you think you can just pull those teeth and get the same arch length, you're mistaken. You leave this, when we do this, we leave the whole root down there. And the permanent cuspid, the first bicuspid, or the starting in there, will have to come up beside that. And you don't lose any of your arch length that way. But if you extract this tooth, I can guarantee you that the bicuspid erupting next to that gap, the crown of the bicuspid will move into that space somewhat, and you'll end up with an expansion problem that you'll have to work with. But I'm getting older and I can't hardly talk sometimes. And so don't be afraid to go in there and do that. You can infiltrate around them and deaden them. I don't block the whole thing, or never did. And we've done this for many, many kids. And let's get it on and see what we have next here. All right, this is still not all the way, and this isn't over there, but it still can correct as we go along. So here we are in 79. You do take a few years, and this lady, this same young lady right here, married and brought her daughter back, and she was in another town, brought her daughter back for us to do this on her. Now we have got this pretty well straight, and the midline now is almost dead on that area. Over there, the uppers have straightened up, and I haven't touched them. Now the upper teeth have come in. I don't know whether we went in and took a little bit more off. You can do that and get them to come in, but the midline looks like it's right in the correct position there. Now, that is the first phase of this. The second phase, we're going in and take this deciduous second molar off right there. I'm sorry that jumped up on us that time, but we'll come in and take the deciduous second molar. I've got something going wrong here, but we'll show that in the next group. We'll take that down. Now you see that tooth on the bottom is just about where it ought to be. I'll tell you, this pin, and you can see the cuspid is coming up in here somewhere like this. It'll be big, and this tooth will be just about to come out anyway, so we take this out, and this won't have much of anything. It may be gone to start with, and you can take this cuspid, put it in here. Now we're going to trim off of the second deciduous molar, and I'm going to do a video on that and show you the whole thing. And this young lady was one that brought her daughter back after she married and grew up, and wanted us to do that. Now you can't promise you this won't need that, but anyway, we did it for her daughter. Now we'll close out, and I hope you aren't afraid to go ahead and do this, and you can straighten up a lot of teeth. And if you think you're going to extract the cuspids up here and get the same result, you don't, because the tooth is set right down in this area. When you take that root out, it has soft tissue to go into it. It'll go forward, and that one will follow it, and this one will follow it, and you will lose arch length. If you do this, your root is not bothered at all. You just cut off whatever you need. I've taken these teeth and cut 2/3 of it and leave it in, and leave the root in there, because the tooth will be more narrow and it'll slide right into place. So thank you for watching, and I'm going to close out, and hope more people will do this, and you're letting nature straighten the teeth out. Okay, I'm going to close up here, and the midline is about the same, and that's it. Thank you for watching, and I want you to join our group and subscribe to it, and I will say goodbye.